This is the Emergency Medical Minute, sponsored by CarePoint and HCA Health One.
I actually had two interesting cases recently that all had the same unique presentation, where I had a patient come in who had fever, altered mental status, headache, and neck rigidity. So what is the presumed diagnosis with this presentation? Meningitis, right? I had another patient come in with the exact same thing. What's interesting is that both of these patients also had acute urinary retention. They couldn't pee. They had bladders that were like 1,500 cc's or so. They were agitated, writhing in the beds, and ultimately just resolved with decompression, and found out that there actually is something called Meningitis-retention syndrome, MRS. It's fairly rare. It's about I think the largest studies showed that there was about 8% of patients with meningitis have this, but it's the combo of aseptic meningitis with acute urinary retention. They think it has to do with Detrusor muscle underactivity from some process of demyelination maybe, but just kind of a unique way that it can present, and it was crazy. I saw it twice in 1 week. So anyway, just something that's kind of a unique presentation of a diagnosis that we see every now and again. Meningitis-retention syndrome.
Cool. Maybe we'll see it a third time.
Hey, Denver listeners. The Emergency Medical Minute invites you to our toxicology fundraiser, also known as Talks 2025, on Thursday, September 11th. It'll be an evening of toxicology education, catered food, and community, with all ticket sales going to charity. Join us from 6 to 8 p.m. at the 11th Avenue Hostel. Get your tickets now through the link in the podcast description.
This has been the Emergency Medical Minute. Thank you to our sponsors CarePoint and HCA Health One. Support from them and listeners like you helps us to continue providing free medical education to the masses. If you found this episode valuable, consider supporting our work and check out the link in our show notes.